church, and this is her daughter,
We're
Ian,
looking at
and her granddaughter, Olivia.
a baby?
Yeah, hers.
Yeah.
I was going to say, is this yours? Well, we can't fix yours.
You're in the
This
wrong
is yours.
department, huh?
Yeah. I'm Dr. Talbot. How you doing?
Hi.
We need to sit down and talk a little bit. Obviously, you had your hearts operated many moons ago. And how old are you now?
79.
79. Okay. It looks like all the grafts that Dr. Herlacher put in are now occluded, so they're shut off. I'm not really sure what shut off. There may be a heart attack coming in, but we know you had a heart attack because your enzymes went up. Typically, when that happens, we like to wait at least a minimum of 5 days after your heart attack to decrease the risk of trying to do another operation, because we know that the risk of dying is higher and lowers a little bit as each day goes by. Okay, so unfortunately you're going to sit around and wait for a while. In the meantime, we know that you got a valve that's a little leaky, and sometimes it's leaky because you just have too much water on board, and so we're going to try to give you a few days, get a bunch of this water off. And then they're going to ask you to swallow the black snake. You know what I'm talking about? Well, we have a way of looking at these valves through your esophagus, but it's a big old snake. It's like an endoscopy where they put it down in, and we can get really good images of your valve. Hopefully, keep your fingers crossed that you don't need anything done with the valve. Because if we have to do something with the valve and try to do repeat bypasses, your risk of the operation goes up. Right now, I think that you're going to wind up with probably 2 bypasses, maybe 3. We can see you have 2 blood vessels still good to go on your left side that we can actually plug into to replumb that, to get you new fuel lines there. What I can't tell is I can't tell on the right side if there's anything there good enough to plug into or not. Okay, so that's the maybe 3 part. If we do this, you'll be in the hospital in like 5 to 7 days. It'll take you 6 months after the surgery. It'll take you 6 weeks to heal up and 3 months to get back to full strength. The bad news is all the things you're afraid of, not surviving it. After a heart attack, if we wait about 5 to 7 days, your risk comes down to about 7% not surviving the operation. Probably a little higher in your age group, okay, and a little higher because it's a redo operation. So we're going to say about 7 to 10%. That's the downside. The other downside is having a stroke, bleeding, infection, you name it, anything can happen to you. You can fall out of bed and crack your head open. Okay, anything's possible. But that's pretty much the story. The alternative is that you say, okay, I've had a good 30 years from that last bypass graft. I don't really want to go through that ever again. And we just tweak you up on your medication so you hopefully stay pain-free, and you go out and you do whatever you were going to do. Okay? So you don't have to go to the operating room. That would be our recommendation, but you don't have to. We do need to scan your leg to see if you have veins left over, if they're any good, if we're going to actually use those for some of the bypasses. Okay?
Okay.
What do you want to do?
I think I would go for the operation.
Again? Okay. Okay. It's a little bit tougher.
When do you break the breastbone again?
Yes, ma'am. We divide it right down the middle.
Okay, that was rough. That tube down my throat is a big fear.
Yeah. I guess you never were a scuba diver then, were you?
No, but the last time the tube got bitten through and slid down my throat. And
You bit the tube in two?
evidently, I don't know.
Holy, I've never seen anybody be able to do that. Those things are
Yeah.
tougher. And
No.
Or are you talking about during surgery, you mean?
No, this
Waking up
happened
afterwards.
afterwards when I was in that room with all those machines, and I couldn't tell them there was something wrong, and they were all chattering, and finally somebody looked at me and said, "Oh my God," and they pulled it out real fast. Of course, my throat was awful sore after that, so that I have a big fear on that.
Have you ever heard of such a thing? I've never known anybody to be able to chew that tube in two.
No, those things are pretty tough.
Oh my! I don't know anybody can chew it in two. And it didn't happen just suddenly either. I mean, you know what I mean. You have to gnaw on that thing like a dog with a rawhide. Okay. Well, anyway, and maybe with little meds on board, that may not be exactly what happened either. You know, we just think that's
well,
what happened.
The tube was broken and slid down my throat.
Okay.
Yeah, so I don't. They said I chewed it. That's all.
Well, it's the only way it could happen is
Yeah.
for you to chew it in two. Okay. Well, we'll make sure you can't do that this time.
Okay, I would appreciate that.
Put a little
The-
bite block in there.
You're worried about breaking the breastbone. You did it? You mean because it hurt afterwards, or?
Yeah, it took a long time for that to heal. That was one of the bad parts of the operation for me afterwards.
Yeah. Well, I mean, but was that? Are you sure that was it? Not just generally.
Oh, no. There were certain things I couldn't do anymore with my hands because of the breastbone being broken. But it healed. It healed.
Okay. Well, that's the story. So so looking at the schedule that we have going on, I don't think you're going to make it into our OR schedule until Tuesday morning of next week. But the truth is, the longer we can set you out, the lower the risk becomes. Okay. So I know it seems like a nuisance to sit around for a week, but it actually decreases your risk.
Well, that's worth it then.
Okay?
And she'll stay here the whole time, right?
Yeah, most likely. I don't see her going home in the meantime. So there's a few things we have to do before we get there. We have to scan and mark your leg to see what kind of tubes we got left over. And we actually need a good look at that valve, and that should happen once we finally get your weight down and get a little extra water off. Okay?
All right.
So when will they check on the heart valve? I mean,
It was really scheduled for today, but I think it's too soon. I think it's still going to look bad, we'd like to get a little more water off. So I'm thinking sometime near the end of the week.
okay.
Okay, and it's a big old black tube about the size of my little finger that we put down, and we can actually image the heart. It is an ultrasound, just like the one that you get on the surface, only we're just going backwards in.
Will she be like twilighted for that? Or?
Yeah, exactly. No vampires though. They're all over the windows. Those bloodsuckers.
Oh God, yeah.
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 They give you medicine, Mrs. Church, just like you had when you had your heart cancer. Remember how you said you could remember stuff that's a little foggy? They'll give you that kind of medicine to do that TEE. You really won't remember.
Right.
Yeah.
Any other questions?
Not right now.
Okay. We'll write them down if you think of them.
Will do.
Okay, because you'll forget them when we
Will
show
you
up.
be her surgeon?
I am so
Okay.
far.
Great.
Only on an outside shot with my associate bid, and it's only because of scheduling time, some issue.
Okay.
Okay? Okay. Any other questions? Nope? Okay. Why do you have a hospital band?
Oh, that was from last night.
She went.
From coming in here.
Oh yeah, I forgot they came.
Yeah,
in.
last
But yeah,
night.
she just had her ultrasound.
And they
Her
have to
first.
band it when they come to emergency.
Oh, I
Yeah, I
see.
came
She had her
back
first
and-
ultrasound this morning. So
I got poked.
Little. We saw little Victor. Or
yes.
Betty.
Well, it's not a
I would
fetus
say
yet.
a little early to know.
Past-
It's an
Past
embryo.
a blastocyst, but not quite a fetus. So
You haven't done that pecker hunt yet, huh?
no, not yet. A little too soon for that.
Put that up a little bit for you. It's
That's what I call that ultrasound.
Yeah.
Because that's all you're doing. I mean, you're
Yeah.
You don't find it. It's obviously that. Girl. You find it's a boy. It's
Yeah.
really a pecker.
But if you look, she's definitely having a Grim Reaper. We've decided,
Yeah, look at
which
it.
is really
Seriously,
appropriate
it's
since she's
not-
due 7 days after the end of the world. So it's like the
supposed
zombie
to-
apocalypse. So
Oh, that's
Yeah.
what they do to the Mayans. Okay.
Yeah,
Yeah.
yeah, right. Yeah, if you look at it
Oh,
to the
they-
side, it looks like a Grim or a turtle.
I don't understand the Grim Reaper
Yeah.
because of the
Here,
the sickle all up there.
look at.
There's this little
eyes
hood and there.
See it? You see it? Come on.
I don't know what she's at.
Well, you can't have one of those. It's like a turtle.
Yeah, it's funny. You and Livy both said, "Oh, it's a turtle."
It's a turtle, yeah.